So strep throat is very common, especially in our young elementary school age group, those kindergartners, first and second graders who are very kind but also put their fingers in their mouths and hold their neighbors' hands and are very good at sharing their germs. And so with those kids that get strep throat, generally they have a very sore throat and a fever. Some of our children have a hard time telling us that their throat hurts and they just have the fever without a lot of other symptoms. The most common reason for a headache in a child is the fever itself. So a lot of our kids with strep throat will say, my head hurts, and have the fever without a lot of other symptoms. When we look at a child that has a very sore throat and a fever, then when their throat is very red, or they might even have some white pus looking areas on their tonsils, and we do a Q-tip test. We do both a rapid test where we get a result in about 10 minutes, and then we double check that to be sure that the strep isn't just starting with a 24-hour test. So with strep throat, generally we use antibiotics, and most of the time that can be just done by mouth. The best prevention for strep throat is to not send your child to school if they have a fever and sore throat until you get this checked out, and encourage all of their friends to do the same. Hand washing is the single most important thing, and hand sanitizer also is good. Kids that bite their fingernails or put their fingers in their mouth are increasing their risk. So when we see our kindergartners, first and second graders, it's good to start working with them on don't put your fingers in your mouth, wash your hands a lot, all those hand hygiene suggestions.